This is an instructional video about back pain. Now, back pain can occur for lots of reasons, but there are recurrent themes in back pain that we can easily do something about with a little instruction about how the back pain occurs. Now, this is not a substitute for medical care. If you need medical care, then you should seek the appropriate professional. This is just going to be an instructional video. There are many things. Fortunately, there's serious back conditions are very rare, 1 or 2%. So common things that could be found on imaging, for instance, herniated discs or annular tears or those kinds of things, are common, and there may not be the cause of back pain. So one of the things that happens with back pain is that it becomes scary. And it becomes scary because, especially if we have back pain when standing, because we feel better when we sit, and then what happens is the longer we sit, we create other problems which make back pain standing worse. So we feel like we're having a worsening of the condition when in fact it's due to some stiffness problems that occur. Now I'll demonstrate some of that. For instance, if I have back pain when standing, but I sit in this chair, there's a couple of, and I feel comfortable in this chair. So I may have some back pain, but when I sit in this chair, I'm good. But one of the problems that happens, if you notice I'm really comfortable in this chair, my back is rounded out, it's flat, so that feels a little more comfortable. But my upper back is getting stiff because I'm sitting with my upper back is stiff and my hips are getting stiff. So then, when I go to stand up, I create more stress on my low back. I'm going to go a minute to the door frame and show you how that works. Okay, so the back pain that occurs when I'm standing usually happens because we have too much curve in the low back. But then if we sit for a while, the hips get tighter and we can't extend the hips all the way, and the upper back gets more stiff and we can't straighten up all this way. So when we go to stand up, then we're putting more stress on the low back and things seem even worse. So when we might get injections or all those kinds of things, but it doesn't seem to be permanent. So one way to check that is to see how well you can flatten yourself up against the door frame. Okay, so if my back is stiff like this and I got a big space in my back here, then we'll have to do some exercises so we can help reduce that space. We need to be able to extend the hips, and that allows us to flatten the back, and we need to be able to flatten the upper back. And if we can straighten the hips out a little bit, extend the hips a little bit, and flatten the upper back, then when we stand up, we can flatten a little back and take some stress off the back. Another thing that commonly gets in the way of back, if you notice, if you raise your arms up over your head, and that makes your back pain worse, well, those are lat muscles that come down into your back, and that easily can cause some back pain. So let's look at some exercises over on the mat to try to reduce some stiffness here and some stiffness in the upper back. Okay, we're over at a mat table. Here we can use a mat or you can use a carpeted floor. And what I have is a rolled pillowcase. It's rolled, so it folded in half and rolled up fairly firmly. That's going to help me focus some of the stretching we're going to do. So we're going to work on stretching some of the upper back area. Now I can lay down and put this across the mid-back area and lay down. Now if this is too much stress on my neck because my upper back is very tight, then we can put a pillow under the head so you're comfortable. If you feel some stiffness where this roll is in your mid-back, that's fine because that just indicates it's stiff there. I'm going to take this headpiece away. Okay, and then from here, if you just raise your hands up towards the ceiling and stretch. Now if you feel some pain into your back doing that, we're not doing any damage to the spine. The spine's perfectly supported by the table. All we're doing is stretching muscles and fascia in the back. And you can do that stretch. If this is pretty easy to do, you can make the roll a little firmer. Here I have a towel. I have a towel wrapped around the prior roll, and we just lay back on that and advance to a little bigger roll and do that same exercise. And you're adding a little flexibility to the thoracic area. Stretching, you can stretch both arms overhead. And another stretch you can do here is you can put your hands behind your head, keep your elbows down, and then move your head and shoulders as one unit, side to side. So working on flexibility in this area. Flexibility in this area helps take some stress off the low back.